In this video by Deckplate, we will understand the VA rating for gynecological conditions. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Gynecological conditions encompass a wide range of diseases, injuries, and disorders affecting the female reproductive system, including the vulva, clitoris, vagina, cervix, uterus, fallopian tubes, and ovaries. These conditions can significantly affect a woman's health, quality of life, and everyday activities. Understanding how gynecological health affects military service is essential for providing female veterans with the care and recompense they deserve. In this video, we will cover the various gynecological-related conditions, their corresponding diagnostic codes, and the criteria for their rating. Note: natural menopause, primary amenorrhea, and events like pregnancy and childbirth are not considered disabilities for VA rating purposes. However, chronic aftereffects from medical or surgical complications during pregnancy can qualify as disabilities for rating purposes. Vulva or clitoris, disease or injury of, including vulvovaginitis, diagnostic code 7610. This condition involves inflammation, infection, or injury of the vulva or clitoris, often resulting in symptoms such as discomfort, itching, pain, swelling, and discharge, which can significantly affect daily activities and overall well-being. Vagina, disease or injury of, diagnostic code 7611, refers to conditions or injuries affecting the vaginal area, leading to symptoms like pain, discharge, or dysfunction. The VA rates this based on symptom severity and treatment needs. Cervix, disease or injury of, diagnostic code 7612. Cervix disease or injury refers to conditions affecting the cervix, such as cervical dysplasia, inflammation, or trauma. Uterus disease, injury, or adhesions of, diagnostic code 7613. Covers conditions like fibroids, endometriosis, and uterine adhesions, causing pain, abnormal bleeding, and fertility issues. VA rates based on symptom severity. Fallopian tube disease, injury, or adhesions of, including pelvic inflammatory disease, diagnostic code 7614. Involves conditions affecting the fallopian tubes, such as infections like PID, adhesions, or injuries, leading to pain, infertility, and complications in the reproductive system. Ovary disease, injury, or adhesions of, diagnostic code 7615. This refers to conditions affecting the ovaries such as cysts, endometriosis, or trauma. The general rating formula for female reproductive organs, diagnostic code 7610-7615, assesses symptom severity, with uncontrolled symptoms rated at 30%, continuous treatment at 10% rating, symptom-free cases at 0% rating. Note: in the realm of VA disability assessments, conditions like ovarian dysfunction impacting menstrual regularity, leading to issues like dysmenorrhea and secondary amenorrhea, fall under diagnostic code 7615 for rating purposes. Uterus and both ovaries, removal of, complete, diagnostic code 7617. It refers to the completely surgical removal of both the uterus and both ovaries. For 3 months after removal, a 100% rating is given, which then reduces to 50% rating thereafter. Uterus, removal of, including corpus, diagnostic code 7618. This surgical procedure involves the removal of the entire uterus. For 3 months after removal, it warrants a 100% rating. Thereafter, the rating is 30%. Ovary, removal of, diagnostic code 7619. Surgical removal of one or both ovaries due to disease or injury. For 3 months after removal, the rating is set at 100% rating. Thereafter, complete removal of both ovaries rated at 30%. Removal of one with or without partial removal of the other, it is 0% rating. Note: if one ovary is removed due to a service-connected injury or illness, and the other ovary is either absent or non-functional for reasons not related to service, a 30% rating will be given for the service-connected loss of the ovary. Ovaries, atrophy of both, complete, diagnostic code 7620. This condition involves the complete shrinking or loss of function of both ovaries, resulting in a 20% disability rating. Complete or incomplete pelvic organ prolapse due to injury, disease, or surgical complications of pregnancy, diagnostic code 7621. Occurs when pelvic organs drop from their normal position due to injury, disease, or surgical complications of pregnancy, rated at 10%. Note: pelvic organ prolapse happens when organs like the bladder, uterus, or rectum slip from their usual positions in the abdomen. This includes conditions like uterine or vaginal vault prolapse, cystocele, urethrocoele, rectocele, or enterocele. Assess pelvic organ prolapse using DC 7621, while separately evaluating related symptoms under specific diagnostic codes. Merge these evaluations with the 10% rating under DC 7621 for a comprehensive assessment. Fistula, rectovaginal, diagnostic code 76-124. Rectovaginal fistula is a condition where there's an abnormal connection between the rectum and vagina, leading to fecal leakage into the vagina. Daily vaginal fecal leaking needing pad wear. 100% rating. 4 or more times a week, but less than daily, needing pad use. 60% rating. 1 to 3 times a week, needing pad wear. 30% rating. Vaginal fecal leakage less than once a week. 10% rating. Without leakage. 0% rating. Fistula, urethrovaginal. Diagnostic code 76-125. Urethrovaginal fistula is an abnormal connection between the urethra and vagina, leading to urinary leakage through the vagina, often requiring surgical repair for symptom relief. Multiple urethrovaginal fistulae. 100% rating. Requiring more than 4 daily appliance or absorbent material changes. 60% rating. Needing absorbent materials replaced 2 to 4 times a day. 40% rating. Needing absorbent materials changed less than twice a day. 20% rating. Thank you for watching this video. Please don't forget to subscribe and like our videos.